Good afternoon, everyone. This is Joy Cameron with VNAA. Sorry about that, mid-cough. Thank you so much for taking the time today to call in for our February 6th Public Policy Town Hall. We appreciate you making the time. I'm going to step through some different regulatory updates with you all, and then I'm going to hand it over to Nathan Constable, who's going to walk through some legislative updates. We will also make time to take questions and answers from you all. At the start of the call, I'm going to cover some information about the new CMS home health conditions of participation. As many of you know, a few weeks ago, the end of the month, December, CMS put out the final rule around the home health conditions of participation. This week, VNAA is sending a letter to CMS expressing our desperate need for the interpretive guidance that they would be sending the states and to surveyors so that we are able to help you make assessments about your ability to meet these new conditions of participation. Further, based on the information that we receive and you share with us, we're going to be sending follow-up questions. However, prior to them releasing the interpretive guidance, if you could let us know about any areas that you have concerns with any particular provisions, you have concern with meeting the July 13th deadline on, we would greatly appreciate that. Also, if there are areas that you feel need greater clarification, one example that I have already sent to CMS asking for clarification on is some of the requirements around CNAs that they have. If you live in a state that does not have any CNA training requirements, there are requirements listed within the COPs, and we're asking for clarification. With a program such as Medicare, usually you have to defer to the higher bar, which in this case would be Medicare's bar, but I just want to raise that as an area that they're going to need to do clarification as well. We will continue to keep you guys up to date and let you know what's going on with these interpretive guidelines that will be so important. I kind of look at it as two prongs, or three prongs rather. You're going to have the regs themselves, CMS's interpretive guidelines, and then your action plan and your operational guides that you create from there, and making sure you have those in alignment are going to be exceedingly important. Additionally, following the call, we can send you the link to our website on our where we've highlighted some of the differences between the two, the current conditions or the final rule conditions that haven't been implemented yet, and the previous conditions, areas of difference between the proposed rule and the final rule, as well as just kind of an annotated overview that we've done as well. Again, if you have any thoughts, whether these are questions you'd like clarification on, areas or provisions that you have concerns with, please don't hesitate to reach out to me. My email address is jcameron@vnaa.org, and that is listed on the staff contact page. So that being said, I just wanted to highlight that for you all as well. Also on that website, for those of you who are able to join us, are both the slides as well as a recording of the webinar that we held 2 weeks ago. So if you, again, have any questions after that or just want to walk through it with someone, feel free to reach out, and we would be happy to help you with that. In addition, I will say we are asking for CMS to give us some guidance and potentially be a part of a webinar that we would host where they could walk through the COPs from their perspective. I think that could be very meaningful, especially if we are still waiting on those interpretive guidelines. Are there any questions around the home health conditions of participation? Heather, do you see any coming in?
I do not see any questions as of right now.
Okay, great. If you all have any, remember you can use the chat function on the website, and we'll work with you that way as well. The other area
I do see questions have come in. One person says that they understand that NAC has contacted CMS for clarification that the COP falls under the new executive order and should be rolled back. Have we heard anything on this?
We have not heard anything about that either. We well, rolled back as in delayed for 60 days. My concern is that they would hold the interpretive guidance for 60 days, but still hold the July date in force. So, you know, that has been part of our outreach to them and asking for them to give over the interpretive guidance and open up their dialogue. We don't feel that the interpretive guidance would be impacted by the executive order, or but we're seeking, you know, like many of us, we're in the situation of seeking clarification. Technically, it mentions health as one of the areas that the executive order does not impact. So some of this is going to be an interpretive game. So we're trying to seek clarification to that as well. Are there any more questions? Great, thank you, Heather. On Medicaid reform, I just wanted to raise for you all, there are some key areas of conversation around Medicaid currently. There are different changes in the way that currently Medicaid is paid for in a way that we have a federal matching grant is probably the best way to look at it. There's a percentage that each state receives that is based on how much their per capita income is per state, and it's either a floor of 50% match where for every dollar of Medicaid dollars spent, the state pays 50 cents and the federal government pays 50 cents. Some states skew all the way up to 75% of Medicaid funds coming from the federal government and 25% coming from the state itself. When there are discussions about significant changes to Medicaid, specifically conversations around Medicaid block grants or per capita caps, there are some key questions that need to be considered in this change, and a lot of these, obviously with this being Medicaid, will be budget battles that you have within your own states. You know, it is unclear exactly how these matching payments would work. What is also unclear, which I think is a little more concerning, is kind of where the baseline spending will be. So I think helping your states make decisions around baseline spending, what their state policy priorities and economic priorities are going to be vital. Making that argument about the value of home-based care is going to be exceedingly important. On our state association call, I shared with them a Kaiser report that's good for setting kind of the tone and conversation, but we continue to work together to talk about the different ways that we can show states the importance of home-based care so that they don't skew their spending in an area that would negatively impact our home-based care providers. Additionally, it's important to keep in mind the role of provider taxes within that construct. Obviously, you know, with the cap of these federal funds coming in a new form of block grants or per capita caps, the role of provider taxes would greatly shift. Many of these providers agreed to provider taxes knowing that it would help draw down additional federal dollars, and you want to make sure that the value is still there, and that that these folks who are paying these taxes don't inadvertently cause home-based care to suffer negatively because of that. So this is just a matter of letting you know conversations are still going on in DC about it. They tend to be on the edges of conversation. They are not going to be a part at this time. I have to specify that. At this time, they are not a part of the repeal or replacement effort, but are running alongside of it, but are something that is being looked at the overall overhaul of Medicare. That being said, I wanted to be sure to bring to your attention that it's going to be very important that you're able to quantify the value of home-based care for your members within your state. And also, as things move, we will be sure to activate you and let you know what's going on federally to potential changes in Medicare as well as Medicaid. Are there any Medicaid questions? Okay, again, if you want to email myself, my email is on the contact information sheet on VNAA.org. Also, it's jcameron@vnaa.org. I will provide also the link to the Kaiser report that we discussed. It might be helpful for you. It's kind of what 5 key questions, you know, what are the 5 key questions around Medicaid and the decisions that are being made now. The other thing I just wanted to highlight for folks is there have been a few questions around MACRA and the role that palliative care is playing in MACRA. You know, this is something that came apart as apparent as some EMR and kind of back office provider company vendors were making adjustments to help the systems run efficiently for January 1st and the start of the new quality payment program, which is what MACRA is called. And in doing so, they have found that there are some impacts to palliative care providers, specifically in years 1 and 2, eligible clinicians, and that includes physicians, physician assistants, nurse practitioners, clinician nurse specialists, and certified registered nurse anesthetists who bill Medicare Part B specifically for more than $30,000 a year and see more than 100 Medicare patients annually. There are some changes to their performance, and there are some changes to the potential for the 5% bonus on top of their Part B billing. I just wanted to highlight that for you all and let you know that in MU we're going to, which will come out tomorrow, we're going to highlight and give some information around the role of these folks and what MACRA specifically means. You know, MACRA was quite a large piece of legislation and went through pretty quickly, and there are kind of tentacles that reach into other areas of care. So we just wanted to make sure that you guys knew that there is a palliative care component for those eligible clinicians. Again, it's for physicians, physician's assistants, nurse practitioners, clinical nurse specialists, and certified registered nurse anesthetists. So what we'll do is we'll have a little bit of information available to you in MU tomorrow. And if there are further questions, feel free to reach out and, you know, and ask them questions. These are obviously folks that are going to be a part of these advanced alternate payment models. So there will be an element of risk to some of the models that they're functioning under. So I just wanted to highlight that for you all so we can make sure you guys are out there and aware. If there's no questions about that, I'm going to turn it to Nathan and let him talk about our legislative update.
Great. Thank you, Joy. So I'm going to go over some of the top priorities for VNAA in 115th Congress, specifically in 2017, the first year, giving an update on a lot of the items that we touched base on at our last public policy town hall call. The first of which, probably the most important for a lot of folks, it's something that we've been driving last Congress, is dealing with the face-to-face legislation, specifically around the documentation requirements and trying to make sense of those. So last Congress, we worked with both Republicans and Democrats on the Energy and Commerce and Finance, or I'm sorry, in the Ways and Means staff, on a bill that would require that the home health agency's medical record would be consulted when sufficient documentation is not available in the physician's medical record. Hopefully that would stop any denials and claims based on insufficient documentation. There was a bill that was introduced in the Senate by Senators Menendez and Senator Roberts, and we had worked with Representative Walden to get a bill in the House introduced. Unfortunately, we weren't able to get it introduced, but we were able to get both sides to come to agreement on language that we hope to have introduced fairly soon here in the 115th Congress. As all of you probably know, Representative Walden is now the chair of the Energy and Commerce Committee, and usually chairs do not sponsor bills. So we've been working with his office to identify new potential Republican leads, both on the Ways and Means Committee, which we think we've identified, and on the Energy and Commerce Committee. But we are hearing that Representative Walden may consider sponsoring some bills in his new role. This is not, we do not know for certain, but if so, that would be great for the chair to sponsor that. So hopefully next month we'll have some more information on when we can look for introduction of the bill. The next item is the Pre-Claims Undermine Seniors Health Act, or the PUSH Act. This bill was introduced in the 114th Congress by Representative Price, now soon to be Secretary Price, and Representative McGovern. And it would put a one-year moratorium on the pre-claim review demonstration that CMS rolled out last year. It's currently active in Illinois and will be active in Florida on April 1st. So we've been working with Representative McGovern's office on trying to pave the way for introduction. Representative McGovern is the co-chair of the Home Health Caucus, which held a briefing last week at VNAA, along with the partnership and the Alliance helped convene. And we're thankful for Representative McGovern for convening that and speaking. And this did come up in our comments. So we'll be working on identifying a new Republican champion. There were Republican introductory co-sponsors last Congress, so we're working on getting this reintroduced. I know that some of the Florida delegation has taken an interest. This is about to roll out April 1st, and we're plugging away, and hopefully we'll have some introduction news the next time we speak, or maybe between then we'll update you in the member update. Going back to another bill that Representative Walden introduced last Congress was the Home Health Care Planning and Improvement Act, and this would allow nurse practitioners and physician's assistants to order home health services under Medicare in accordance with state law. So it has broad bipartisan support. It's been introduced in many Congresses, and last Congress it was on its way to passing. However, CMS provided some technical assistance that did raise some quality of care issues and cost issues that we really tried to make sense of in meeting with CMS, and unfortunately we were not able to get resolved last Congress, but us and a coalition of other organizations are working to get the bill reintroduced in the 115th, but also trying to iron out some of the issues that CMS had with the bill, really so that we will not hit any roadblocks in the 115th Congress and stall the momentum that we had last Congress. So we're working closely with Representative Walden's office to identify a Republican. Who knows, maybe it might be a bill that the chairman would consider sponsoring. While it is unlikely, there is that possibility. So moving on to the hospice side, the Palliative Care Hospice Education and Training Act, which would do three things. It would put in place education, palliative care and hospice education, also raise awareness about the benefits of palliative care and hospice, but then also include funding for research into palliative care services. And this is a bill that's been introduced, and last year it was introduced in the House by Representative Reed and Engel, and it had 234 co-sponsors and did have a hearing, so it cleared an important procedural hurdle, had broad bipartisan support, and it was introduced in the Senate for the first time by Senator Baldwin, and Senator Shelley Moore Capito came on as the Republican on that bill. So we are hearing that the bill will hopefully be introduced toward the end of the month, and we're part of a coalition, a broad coalition of organizations that have really made this a priority to get passed in 2017, based on the support that it had last Congress, 234 members. We're currently working with that coalition to strategize the best ways to go about that, identifying certain champions from the last Congress that are on the committees, and bringing along other members of their delegation so that who knows, maybe we'll have a veto-proof number of members on this bill, but that is something that we're working on, and hopefully by the time we talk in March, we'll have a bill that will be introduced. So like I had mentioned earlier, we did have a successful briefing with not only Hill staffers, but House staffers and Senate staffers made their way over to the House side for a home health care briefing on innovations in home health care that Representative Representative McGovern and Representative Walter, the co-sponsors or the co-chairs of the Home Health Caucus, chaired and sponsored, and Representative McGovern spoke. So we hope to work with that caucus and just raise awareness among staffers and members of Congress on what's going on in the home health industry, the innovations that are being made, as well as certain barriers that can be easily addressed by legislation. So we hope to continue working with the caucus and having future briefings. So we will keep everyone updated on what happens. I know there was a lot of interest in webcasting the previous briefing. So moving forward, we will work on having that capability so that our friends outside of DC can listen in and watch. So that is all that I had. If anybody had any questions.
I have a question for you. So one of the questions we received is, what were the issues that need to be resolved with the home health care planning improvement?
Basically, it was around the nurse practitioners and physician's assistants. We were almost sort of questioning why those were issues, and when we did meet with CMS, and Joy, you were there, yeah. They were almost, it seemed like they were there for the wrong meeting, but
but they did hold it up.
Yes, they did hold it up. Basically, there were concerns that this might create an influx of people, which would eventually cause the cost to go up. But.
Right. CMS in their thinking never sees this as a situation where there will be less folks that go to a physician to get orders for home health care. They just see it as a potential increase of individuals that would end up getting home health care. So regardless of the fact that if you already saw an NP for your primary care and for home health care orders, you would need to step out, see a physician to get the specific order from a physician, and then continue on with your NP. That wasn't really part of their dialogue and their thinking. So what they proposed was that there would be about 30,000 additional episodes a year, and that over 10 years would be a $1 billion coster. So when we asked for some clarification and exactly, what the math was to get to that kind of assumption, and what if there be an offset from individuals who weren't interrupting their integrated care to see physicians just for this one thing, the Hill staff pushed the question to CMS. So we are hoping that at this point there will be a new look, especially with a new Congress, and that if and when it gets introduced again, that hopefully there will be a less aggressive score, or that there'll be some language around the fact that this will allow people to continue to have integrated care and stay with a physician or physician's assistant or nurse prac that they know, rather than interrupting their coordinated care just for basically an administrative function. Obviously, advanced practice nurses all have the training and licensing. This is just an area where they're contained from practicing to the full scope of their license. So, Heather, are there any more questions?
I don't see any other questions as of right now.
Okay, great. Thank you so much, Heather. That being said, if you guys do have any further questions later on, my email address again is jcameron@vnaa.org. We're happy to take any questions. Again, I would just like to highlight that if you have any specific provisions you're concerned about with the home health conditions participation and you'd like to reach out and let us know, we'd greatly appreciate that. If there are any areas where you have you feel that we need greater clarity, we're happy to highlight those as well. That being said, Nathan, do you have anything?
I do not.
Okay, great. Thank you all for taking the time today to listen in. We look forward to speaking with you soon, and if not, we'll see you back here again next month. Thank you so much.